Assalamu alaikum. I am Dr. Furqan Ahmad. I am FCPS Nephrology, consultant nephrologist at Dr. Atta Memorial Hospital, Rawalpindi. Today, I am going to discuss about kidney failure. It's a very big issue that is very harmful, and most of the patients are unaware of the severity and they don't bother to treat their basic diseases that are leading causes of kidney failure. Kidney failure means your kidneys are no longer able to work well enough to keep you alive. With the kidney failure, 85 to 90% of your kidney functions have gone. People with kidney failure have stage 5 kidney disease with a GFR almost less than 5. And the patients with the kidney failure will ultimately need either dialysis or renal transplantation. Signs and symptoms of kidney failure. Kidney failure is a result of gradual loss of kidney function. Some people even they don't know that they have kidney disease until they reach kidney failure. This is because people with early kidney disease may not feel sick. Symptoms usually show up later in advanced diseases. And what are the symptoms that patient can have? Decreased urine output, itching or dry skin, feeling tired, shortness of breath, swelling over body, numbness, muscle pain or cramps, nausea or vomiting, loss of appetite, altered sensorium, and sometimes patient present in emergency department with severe shortness of breath, heart block, or loss of consciousness. Main causes of kidney failure are diabetes, hypertension, recurrent kidney stones, painkillers, glomerular diseases, and some chronic diseases that remained either undiagnosed or not treated properly. What are the complications of renal failure? Patient can present with anemia, decreased blood, decreased hemoglobin. With decreased hemoglobin, patient can be tired, short of breath, muscle weakness, palpitations, tiredness. Patient can also present with metabolic acidosis. In severe metabolic acidosis, patient will ultimately need dialysis. Minerals and bone disorders. Patient can have hypocalcemia, means low calcium. Hyperphosphatemia means high phosphorus. Patient will have high parathyroid hormone. Hyperkalemia, increase in serum potassium level. Hyperkalemia can present with sudden heart block. Pulmonary edema means fluid in lungs parenchyma. Patient with pulmonary edema will present with severe shortness of breath. They would not be able to lay down due to shortness of breath. How to diagnose kidney disease? Is by blood test, by urinary test, and by imaging. In blood, you need CBC, complete blood picture, renal function test like urea, creatinine, uric acid, electrolytes like sodium, potassium, bicarbonate, special chemistry like urea, creatinine, calcium, phosphorus, serum albumin, urinary to look for protein, blood, or any infection. And imaging studies like ultrasound or CT scan to look for any pathology, size of the kidney, echogenicity of the kidney, or any other structural defect that may be present that is the cause of end stage renal disease. That might be the cause of end stage renal disease. How to manage patient with the kidney failure? Education, educate the patient about his health, about nutrition, about fistula or dialysis catheter, about the management of the complications. So we give options for hemodialysis or peritoneal dialysis, and third one is the renal transplantation if patient is capable, suitable for transplant. Second thing, we give nutritional consultation for diet plan, what to eat and what not to eat. We have focus on his diet Low potassium diet, low phosphorus, low sodium, diet with adequate protein intake, adequate minerals, adequate essential amino acids. We give diet chart to the patient and ask them to eat what you can eat from this diet chart. If you want to eat something that is with the high potassium and high phosphorus, you can eat during dialysis session, but not every time. We ask them to decrease fluid intake because if patient will not decrease his fluid intake, he will present with severe pulmonary edema multiple times and ultimately will harm his heart or his or her health. Besides nutrition, we have to give medications to manage complications related to renal failure. We have to give multivitamins, iron supplements to treat his anemia and erythropoietin injections on weekly basis. Along with that, we have to give calcium supplements to improve calcium and to decrease phosphorus. We have to give bicarbonate to treat metabolic acidosis and other medications for hypertension, diabetes, and infections or medications to decrease parathyroid hormone. This is all depends on patient's reports. Patients should have to consult their physician, that must be nephrologist, so that patient should be able to live a healthy life even on dialysis to prevent hepatitis B, pneumonia, and flu. This is all about renal failure, its causes, management, and treatment. I hope this video will help you to understand basic knowledge of chronic kidney disease and you might be able to teach others, and I think you will share this video to those who are in need. Please like, share and subscribe my channel, and if you want to ask something you can comment and by texting on my WhatsApp number, that is 0300 123 8359. Assalamu alaikum.